Hello friends, welcome to this new video. It's actually part 22nd of the solved Pharmacy MCQs video series. So let's move to this new set of MCQs and we will try to solve them. So be with me. Thank you. So friends, our first MCQ: normal blood levels of white blood cells in adults is approximately in the range of. In this MCQ we are asked about the concentration of white blood cells in the blood normally in healthy subjects. So these ranges are given, and the correct option among these is 3,500 to 10,500 cells per microliter. So this is the normal range for the white blood cell level in the blood. Now our second MCQ: what is the best system of medicine or best system of healing to treat infectious diseases? So naturopathy is an option, Ayurveda, acupuncture, allopathy and herbal system. So actually among these systems of medicine, one is based in science, and that is actually the mainstream system of medicine, because it is scientific, and the drugs that are used in this system of medicine are actually passed through a lot of stages before they are become available in the marketplace. So the option here is allopathy. It is actually the English system of medicine, and this is the mainstream of medicine, and it is considered to be the best system of healing or medicine to treat infectious diseases. Now our third MCQ: what is Torsades de Pointes? Fatal heart rhythm, fatal foot infection, fatal brain damage, fatal internal injury, fatal appendix rupture. Actually, Torsades de Pointes is a heart rhythm disturbance, and it is a fatal heart rhythm actually. So Torsades de Pointes is a fatal heart rhythm. Now our fourth MCQ: which one of the following medications requires storage in a freezer during its shelf life for maintaining integrity of the formulation? So options are given: insulin, antibiotic liquids, timolol eye drops, certain ear drops and dinoproston. So we are asked in this MCQ to identify the drug that is required to be stored in freezer during its shelf life. So actually all these above options, insulin, antibiotic liquids, timolol eye drops, certain ear drops, they require storage but in the refrigerator, except this compound dinoproston, that is to be stored in freezer. And this compound is actually vaginal suppository, and it is chemically a prostaglandin, and this substance induces labor in women. Dinoproston is also naturally produced in the woman's body during induction of labor. So dinoproston is the medication that requires storage in freezer, but before use it is to be brought into the room temperature. Moving on to the fifth MCQ: what is multiple myeloma? So options are given: uterine cancer, blood cancer, spine cancer, brain cancer, and chest cancer. Actually, multiple myeloma is the cancer of white blood cell. So it is actually a blood cancer, a type of blood cancer. Now our sixth MCQ, what is polycythemia? Polycythemia definition is asked about in this MCQ. So options are given: abnormally high RBCs, that is red blood cells, abnormally high white blood cells, abnormally high platelets, all of the above, and none of the above. Actually, polycythemia is an increase in the number of RBCs in human blood. So this condition is named polycythemia, and the opposite of polycythemia is anemia, that is decrease in the number of RBCs. So when this condition occur, when the concentration of RBCs rises high abnormally from the normal range, then our blood becomes thicker, and other cardiac complications can develop due to this thick blood. For example, blood clots. So polycythemia has the risk for blood clots also. So it is actually abnormally high RBCs, that is red blood cells. Our seventh MCQ, we want to prepare a syrup batch of 1200 liters in which we will be adding 8 kg of an active substance. Calculate how many milligrams of the active will be there per 5 ml of the syrup. So this is actually a calculation problem, and in this MCQ we are asked that we want to prepare a syrup batch of 1200 liters in which there we will be adding 8 kilograms of an active substance. So how many milligrams of this active will be there in each 5 ml of the syrup? So let's try to solve this via our calculator, and we will try to solve this MCQ here. So there are 8 kilograms of the active substance per 1200 liters. So how many milligrams of this active is going to be there per 5 ml? So it's actually a cross multiplication question. We know that 8 kilogram of active is there per 1200 liters. So 8 kilogram will be equal to 8000 milligrams, and 8 kilogram will be also equal to 8000 milligrams. So these much milligrams are there in 1200 liters. So we will divide this by 1200 liters, and 1200 liters contains, we know that 1200,000 milliliters. So now we know that 800,000 milligrams are there in 1200,000 milliliters of syrup. So how much milligrams will be there in 5 ml of syrup? So we will multiply this by 5 and we will get 33.33. So option C is the correct option here. Now our 8th MCQ, the popular hand wash Dettol contains dichlorobenzyl alcohol, amyl metacresol, chloroxylenol, benzalkonium chloride, and hexyl resorcinol. Actually it is chloroxylenol. This is the active substance in the popular hand wash Dettol. This is antiseptic liquid. Now our ninth MCQ, one shot of medroxyprogesterone acetate gives contraception for a single day, 3 days, 1 week, 1 month or 3 months. Actually one shot of medroxyprogesterone acetate gives contraception. This is actually a contraceptive. Gives contraception for 3 months. That means in a year you will have to have 4 shots of medroxyprogesterone to have contraception around the year. Now our last MCQ of this video, all of the following progestogens as contraceptives are given orally except one. So options are given: norgestrel, drospirenone, norethindrone, norgestimate and medroxyprogesterone. So the MCQ asks us to identify the contraceptive that is not given orally. As we have learned in the previous MCQ that one shot of medroxyprogesterone gives contraception for 3 months, so it is actually medroxyprogesterone that is given intravenously or intramuscularly and not given orally. So E is our correct option here. So friends, I think this was enough for now. Thanks for watching.